Okay, hi everybody. This is Dennis again, and I'm here with me today, Kiko. So I'm seeing him in the flesh right now. So Kiko, his actual name is Franco Endayat, and he's the youngest of the family right now. So the parents are actually sitting in front of me, but they're actually very shy to come on the camera. So the parents are both born and raised in Batangas, Philippines, and the father himself is actually a self-employed law agent. His income is actually quite unstable, and the mother is a registered nurse. And both of them are working very hard, to take care of the family. You know, Kiko is a beneficiary of this Cancer Warrior Foundation and in the Philippines. So if you guys had actually followed me during March in 2022, I was in Philippines and I met up with Cancer Warrior Foundation in this place called Batangas. And Kiko's case was actually presented to us because very shockingly, he has been fighting leukemia for almost 14 years. So he is currently 17 years old, and he was first diagnosed when he was 3 years old. So today he is still fighting, and I actually kind of like admire him because he has this fighting spirit in him. For 14 years you're doing chemotherapy and you're not giving up. And the thing is that he has been doing that in the Philippines for the last 14 years, but there's not much improvement. So he was presented to us and hoping to be given a chance to come to Singapore to find one of the best doctors. We have one of the in Singapore itself, we have some of the best medical facilities here. So with the help of Cancer Warriors and the doctor over in the Batangas called Dr. Mei, and of course with myself, and Kiko's case was presented to NUH in Singapore for CAR-T therapy. So the treatment will give Kiko more than 50% chances of cure compared to if it is untreated. At least there is still 15% of survival. So this will transform his life after he is fighting for 14 years doing chemotherapy. So now Kiko is in Singapore in the flesh, and he's continuing his treatment here using the CAR-T therapy. So what is actually CAR-T therapy? CAR-T therapy is actually a method of harvesting the patient's cells to genetically modify, alter them, and then infuse the resulting CAR-T cells into patient to attack the cancer. So in Singapore, NUH is doing a very good job for this. So which is why, thanks to you, Dr. Allen, you're doing a very good job. So I hope that you can actually help Kiko here. But they are here like for 2 months, and sad to say the recent harvesting was not really successful. Though the procedure was done successfully, probably it's because Kiko has an infection, and T-cell harvested was not in the good quality. But they are not giving up. So right now he's kind of like resting. Kiko is resting, so that he can proceed to the next harvesting very soon. So from here, I would like to thank you to all donors that come forward to help one way or the other, to give Kiko a chance, after 14 years of chemotherapy. And it's truly amazing that your kindness and generosity had give Kiko a second chance of life. And Kiko is only one of the many CAR-T patients that we are helping. So you guys can actually go onto our site and check out those that we are helping. So Kiko, would you like to say anything to your donors?
Thank you so much for.
Okay. Hey guys, thank you, and don't stop giving. Nothing is actually more satisfying than knowing that the money that you have donated is helping the exact person. All right, thank you.